Have you recently noticed changes in how often you urinate at night, or felt unexpected discomfort while sitting? You might think it's just part of aging, but these subtle shifts could be silent signals from your prostate. Prostate cancer is the second most common cancer in men. The risk rises sharply after age 60. The problem? Its early signs often fly under the radar, mistaken for benign aging issues or urinary conditions. By the time it becomes obvious, treatment options can be more limited. In today's video, we're focusing on a topic that affects millions of men worldwide, yet remains shrouded in silence. We'll uncover 5 silent signs of prostate cancer that seniors often overlook, and recognizing them early could make all the difference in protecting your health or that of a loved one. Before we dive in, make sure to subscribe to Golden Aging Health and hit the bell icon so you never miss out on life-saving health updates, designed especially for people over 60. Let's start with the first signone that most men over 60 write off as just getting older, but might actually be a red flag. Symptom number 1. Frequent nighttime urination, nocturia. Do you find yourself getting up multiple times during the night to use the bathroom? If so, you're not alone, but it might not just be aging. As men age, the prostate gland can enlarge or develop cancerous cells that press against the urethra, leading to more frequent urges to urinate, especially at night. According to a 2022 study from the National Institutes of Health, nearly 70% of men over 60 experience nocturia. While this is often dismissed as a benign issue, it could actually be an early warning sign of prostate cancer. Let's talk about Paul, a 66-year-old retired teacher. Over the past few months, he started getting up 2, sometimes 3 times a night to pee. He thought it was just aging, but when it started interfering with his sleep and energy during the day, he finally brought it up at his yearly checkup. His doctor ran a PSA test and found early-stage prostate cancer. Because it was caught early, Paul was able to begin treatment with excellent results. If you've been waking up frequently at night to urinate, type "night" in the comments. Sharing your experience might help another senior realize it's time to see their doctor too. Now, let's move to the second signal that's even more overlooked and often blamed on stress or an aging bladder. Symptom number 2. Difficulty urinating or weak urine stream. How long does it take for your urine to start flowing once you're standing at the toilet? For many older men, this small delay or a weak stream might feel like a normal part of aging, but it can be much more than that. In fact, these subtle changes are among the most common early signs of prostate cancer. A large clinical study published in European Urology reported that nearly 50% of men diagnosed with prostate cancer had trouble starting urination or experienced a noticeably weaker stream prior to their diagnosis. This happens because an enlarging prostate, especially one affected by cancer, can compress the urethra, slowing or disrupting urine flow. Take Jim, a 72-year-old grandfather. He began noticing a strange pause before urinating, followed by a weak, inconsistent stream. Thinking it was harmless, he delayed seeing a doctor. But during his routine physical, he finally mentioned it. His doctor ordered a PSA blood test, and further tests revealed early-stage prostate cancer. Thanks to early detection, he received treatment in time. If urination has become slower or harder to start, don't wait to speak up. Small changes like this could be your body's quiet way of asking for help. Up next is the third sign of symptom. Many seniors mistake for joint stiffness or poor posture, yet it may point to something far more serious. Symptom number 3. Pain or discomfort while sitting. What could constant soreness in your lower back, hips, or pelvis really mean, especially when it only happens while sitting? Many seniors assume this kind of discomfort is from aging bones or a soft tissue strain, but it can also be a warning sign of advanced prostate cancer. Harvard Health notes that when prostate cancer spreads beyond the gland, it commonly affects the bones, particularly in the pelvis and lower spine, causing persistent dull pain. This discomfort often becomes more noticeable when sitting, as pressure is applied to the affected area. Unfortunately, many men dismiss this symptom as arthritis or poor posture, delaying diagnosis and treatment. Richard, a 69-year-old retiree. He started feeling a deep ache every time he sat down, particularly during long car rides or meals. He thought it was just sciatica or arthritis. But after months of worsening discomfort, a visit to his doctor led to further scans and a diagnosis of stage 2 prostate cancer. Because it hadn't yet spread far, Richard was able to receive targeted treatment in time. Persistent pressure or pain while sitting is not something to ignore. If you feel like you're constantly adjusting your seat to relieve discomfort, it may be time to ask your doctor about your prostate. If you found this information helpful, be sure to like and share this video with a friend or loved one, especially someone who is experiencing similar symptoms. This video could save their life in the future. Let's explore the fourth symptom that can appear suddenly and feel alarming, but is often brushed off as a urinary infection. Symptom number 4. Blood in urine or semen. Have you noticed blood in your urine or semen? While it's easy to brush off as a result of a minor injury or urinary tract infection, blood in the urine or semen can be one of the most alarming and crucial early signs of prostate cancer. The National Institute on Aging highlights that as men get older, changes in the prostate, particularly cancerous growth, can cause blood vessels to rupture or become irritated, leading to occasional bleeding in the urinary or reproductive tract. Though the amount of blood may be small, this symptom should never be ignored. That's what happened to Mark. At 65, he noticed a bit of blood in his urine. He figured it was nothing serious and tried to ignore it. But when it didn't go away, he finally saw his doctor. Tests revealed early-stage prostate cancer that had just begun to spread. Because he acted in time, treatment was effective. Don't ignore blood in your urine or semen. It's not something to wait out. It's a symptom that requires immediate medical attention. Next, let's take a look at the fifth and final symptom that's easy to overlook but could be a game-changer for early detection. Symptom number 5. Unexplained weight loss. When was the last time you lost weight without trying and didn't know why? For seniors, gradual weight changes are common, but losing a noticeable amount of weight without changing your diet or activity level can be a red flag. In some cases, it may be an early sign of prostate cancer. Come to the story of Edward, a 70-year-old retiree who started noticing his clothes felt looser without making any changes to his diet or routine. Over 2 months, he dropped nearly 12 pounds without changing his eating habits. Friends mentioned he looked slimmer, but he just felt more tired and figured it was part of aging. At a routine checkup, blood tests and scans revealed prostate cancer that had already spread to nearby lymph nodes. Thankfully, it was caught early enough for treatment to begin right away. If you've lost more than 5% of your body weight in a few months without trying, it's worth a conversation with your doctor. Sudden weight loss might be your body's way of signaling something serious. Are you experiencing any of these signs? Drop your experience in the comments below. Your story could help someone else recognize the signs before it's too late. Let's take a quick moment to review the 5 silent signs of prostate cancer that older adults should never ignore. Frequent nighttime urination, difficulty starting or stopping urine flow, discomfort while sitting, blood in the urine, and unexplained weight loss. These symptoms might seem minor or age-related, but they could be early warning signs of something far more serious. Early detection makes all the difference. While prostate cancer often progresses quietly, catching it early greatly improves the chances of successful treatment and long-term survival. Research from the National Cancer Institute shows that early-stage prostate cancer has a nearly 100% 5-year survival rate, compared to much lower rates when diagnosed late. That's why paying attention to these signs truly matters. If you or someone you care about is experiencing any of these symptoms, don't wait. Talk to your doctor. Ask questions. Request a PSA test. And trust your instincts. Your body knows when something's wrong. If this video helped you, give it a like and hit subscribe for more reliable health guidance focused on seniors. And please, share it with friends or family. Your action could help someone catch cancer early and save their life. For more tips on protecting your health and aging with strength and confidence, check out the other videos on this channel.